طيب يعطيكم العافية جميعا. اليوم إن شاء الله راح نكمل ما تبقى من محاضرات الدايوريتكس اللي هو الجزء الثالث من محاضرات الدايوريتكس. حكينا عن الدايوريتكس بالمحاضرتين السابقات، حكينا عن various classes of diuretics. في البداية حكينا عن الكربونيك anhydrase inhibitors وحكينا عن اللوب diuretics. هم فعليا أهم class of the diuretics that are commonly used زي الفيروسامايد طبعا. وبعدين انتقلنا للحديث عن الثيازايد دايوريتكس، وحكينا عن الثيازايد دايوريتكس specifically two molecules اللي هم الكلوروثيازايد and the hydrochlorothiazide، وذكرنا عنهم وعن خصائصهم، حكينا عن structure activity relationship. اليوم المحاضرة هاي راح نكمل بالثيازايد دايوريتكس، وراح نحكي عن الجزء الأخير أو الكلاس الأخير من الدايوريتكس اللي هم البوتاسيوم سبيرينج دايوريتكس. تمام؟ طيب خلينا نحكي عن ما تبقى من الثيازايد دايوريتكس اللي هم فقط structures حكينا عنهم الثيازايد like diuretics. والثيازايد like diuretics are compound that don't have the same core structure as the basically the previous thiazides اللي حكينا عنهم. وحكينا تذكروا سابقا شيء اسمه benzothiazine is really the core moiety for the thiazide diuretics. صحيح؟ وإذا بتحبوا ممكن نرسم structure for benzothiazine as well, and this is the structure of that. There's a phenyl ring, a benzene ring, attached to it basically another ring that has nitrogen, carbon double bond, حكينا عن nitrogen, as well as the sulfur, and two carbonyls, and then that's attached. So this is called benzothiazine. وهاي الرينج زي ما حكينا سابقا مش موجودة بهاي الكلاس اللي راح نحكي عنها. تمام؟ This ring does not exist in thiazide-like diuretics. You will see that these thiazide-like diuretics have a little bit of a different structure, where they have a sulfamyl group that's para to the activating group of this structure. So you will see the core structure of these thiazide-like diuretics, that they have a phenyl ring with sulfonate group as well, like the previous like the previous thiazide diuretics فيهم كان phenyl ring وعليها sulfamoyl moiety. صحيح؟ وهي هاي السلفامويل، فعنده بنزين سلفامويل، وراح تلاقي انه في عندنا هنا electron withdrawing، وهذا الحكي نفس الشيء موجود بالثيازايد diuretics similarly in the structure. But what is really interesting is that this structure has only one cyclic ring. So there is a second sulfamoyl para to this activating group, and then this can be various aromatic rings. So it's very simple compared to the previous thiazides that we talked about, like hydrochlorothiazide with thiazide. So the structure has two sulfamoyl moieties that are basically meta to each other. صح? These two sulfamoyl moieties, so this is why we call them, they are meta disulfamoyl benzene. This is the core structure. بالإضافة إلى وجود فعليا عندي هون electron withdrawing group اللي حكينا عنها والaromatic rings اللي موجودة على الرينج. Okay, so basically you will see that this is the core structure that we have in many of the structures that belongs to this class. However, in a newer generations you will see that this structure has changed, where basically this sulfamoyl was replaced, the second one here, which is para to this electron withdrawing group اللي هون or para to this X. This sulfamoyl has been replaced with other electron withdrawing groups. So you will have two electron withdrawing groups in the structure, as you can see, in addition to وجود هاي السلفامويل. طبعا وجود هاي السلفامويل very essential، ما بنقدر نغيره هون. بس السلفامويل الثانية اللي كانت موجودة para to this X has been replaced with other various electron withdrawing groups, and it was found that just one sulfamoyl is necessary for the activity, while the other sulfamoyl was just basically exist for its electronegative properties، يعني موجود فقط ليكون electron withdrawing, and you can replace it with other kind of electron withdrawing groups in the structure. So the newer structure has only one sulfamoyl in the structure, as well as other electron withdrawing meta to it and ortho to it اللي هي الاكس محل الاكس والميتا محل السلفامويل. خلينا نشوف الحكي هذا اللي بنحكي عنه شوي نظري على structure example على on a structure. You'll see in the next structure, which is indapamide. This is the drug that we're going to talk about is the indapamide. Indapamide is a structure that is thiazide-like diuretics. ليش؟ لأنه ما في البنزوثياديازين رينج اللي حكينا عنها سابقا، صحيح؟ وبالتالي الستراكشر هون you will see it has a phenyl ring with the sulfamoyl وهذا أهم جزء بالستراكشر. ميتا راح نلاقي electron withdrawing وهي كلها عبارة عن electron withdrawing group، وعندنا a second electron withdrawing as well اللي هي محل الإكس موجود a second electron withdrawing group بالstructure. So you will see that there are two withdrawing groups next to this sulfamoyl moiety. Now this is again a structure that's a thiazide diuretic and it works the same mechanism as thiazide-like diuretics and works the same mechanism like other thiazides, which basically inhibition of the sodium chloride co-transporters and so inhibition of the sodium reabsorption in general. The structure is in this is also called chlorothalidone, and the chlorothalidone is not a thiazide, so it's different than thiazide in terms of its structure. Okay. So what is the advantage of indapamide? Indapamide has typically longer half-life than compared to a hydrochlorothiazide and thiazide. So it does have a significantly higher or better half-life than the chlorothiazide or hydrochlorothiazide. Indapamide has about 26 hours, almost half-life. But the chlorothiazide and the half-life is around 5 hours, 4 to 5 hours maybe. And that makes this compound basically has to be given multiple times in the day. Like an indapamide permit once daily dosing because of its long half-life. This is the most important thing about indapamide. ليش يستخدم أكثر فعليا من الكلوروثايزايد hydrochlorothiazide إنه has a longer half-life because of its structure. It's basically, we'll explain just in a little bit here why this compound has a longer half-life. The half-life of this compound is around 26 hours, which allows the compound to be given once a day dosage or daily dosing, and that is very convenient for those kind of patients. So why does it have a long half-life? It's believed the main reason that this compound binds in an irreversible fashion to the carbonic anhydrase اللي حكينا عنه سابقا بالمحاضرات السابقة. قد يستخدم as one of the classes of diuretics اللي هم carbonic anhydrase inhibitors. هذا structure, because it has similarity to the other carbonic anhydrase we talked about previously, and if you look at the other carbonic anhydrase inhibitors that we talked about, you'll see that they have the sulfamoyl moiety, and so that sulfamoyl moiety makes the structure here as active binder, let's say, to the carbonic anhydrase in the blood. So it binds to the erythrocyte carbonic anhydrase, and that binding to erythrocyte carbonic anhydrase allows the structure to stick to erythrocytes and get slowly released from erythrocytes over longer time. So that what gives us a long half-life is because of its reversible binding nature to erythrocyte carbonic anhydrase. وراح ارجع اذكر اذا بتتذكروا سابقا بمحاضرات الكربونيك انهيدريز انهبيتورز حكينا عنهم سابقا وحكينا عن الستراكشر تبعهم وحكينا اهم مويتي في الكربونيك انهيدريز تو انهبيت كربونيك انهيدريز اور بايند تو ذس، وراح امسح اللي رسمته هنا عشان نقدر نحكي. اهم مويتي على الاطلاق هي فعليا اي مويتي، هي هاي المويتي اللي هي basically الفينل رينج مع السلفامويل مويتي. So the sulfamoyl moiety and the phenyl ring، وهي جزء من انتي بايوتيك حكينا اللي هو السلفينيلاميد that استخدم لفتره ووجد انه له activity as a diuretic through inhibition of carbonic anhydrase. So that moiety allows the binding of this indapamide to the carbonic anhydrase in the blood, صح? And that will result in what we call like an extended slow release form of the drug because it's bound to carbonic anhydrase and slowly get released from this carbonic anhydrase in the blood, and so that basically results in a longer half-life, much longer than what we typically see in other thiazide structures or thiazide diuretics اللي حكينا their half-life is typically 6 hours, 5 to 6 hours. So this is the main advantage of these thiazide-like drugs, are basically just they are longer half-life because of their structure, the way they bind to carbonic anhydrase in the blood, or erythrocyte carbonic anhydrase. Okay. All right. So let's talk about the next group of compounds, or the next class of diuretics compound. Class of diuretics that we'll talk about the potassium sparing diuretics. And these diuretics work on the late distal tubule, convoluted tubule, or the collecting duct. So they work in the late distal tubule and the collecting duct, where about only 2% of the sodium get reabsorbed. So it's not so important in terms of diuretic effect, because there is only very little amount of sodium get basically reabsorbed there. So preventing that sodium reabsorption might have some weak diuretic effects, but not so much of a diuretic effect, because of the amount of sodium is very little there to be reabsorbed. All right, so what is it more important for? It's these kind of diuretics are more important for potassium and acid-base balances. And from their name, they're called potassium-sparing diuretics, because they preserve potassium from being excreted, and so that helps in reducing hypokalemia chances when you use those diuretics with other these kind of diuretics, potassium sparing diuretics, with other kind of diuretics. So let's take a look at the chart over here, and I will use my pointer. You'll see that this is the urine side, and this is the blood or basolateral side. So this is the tubular side, and this is the blood, and these are the collecting tubule cells. In these collecting tubule cells, we have two important elements that we should focus on. These are the epithelial sodium channel and the sodium potassium ATPase. So what happened here is that in the case of reabsorption, when there is no drug in there, you'll see that the sodium gets reabsorbed through these ENAC, or the epithelial sodium channel. These are specialized channels for sodium. The sodium gets reabsorbed from them back inside the cell of these tubule cells. And then once they are inside, the sodium inside the cell, there is a sodium potassium pump, sodium potassium ATPase pump, that will take sodium back to the blood and kick one potassium ion out into inside the cells. Now this extra potassium that goes from the blood to this inside the tubule cell, there is a channel for it, and these are epithelial potassium channel that basically allows the release of these potassium back into the urine, where it will be excreted as well. And so you will see the net effect is that there is a sodium that goes back to the blood in from these cells, gets reabsorbed to the blood, versus one potassium ion that gets excreted out into the urine. And basically, if we inhibit this process, what happens is that you leave the sodium back, you prevent the reabsorption of the sodium, and you preserve the potassium to stay in the blood. Okay, so this is very essential. How can we block this process? Is by blocking one of two things. Either you block these ENAC, epithelial sodium channels, or you block the sodium potassium ATPase active pump, or the pumps that are used for transporting these sodiums back into the blood. And so there's two ways to do that. Either you inhibit this ENAC, or you inhibit sodium potassium ATPase. And this is where those potassium sparing diuretics comes. There are two types of potassium sparing diuretics. One of them are called aldosterone receptor antagonists, and these are compounds that inhibit basically the biosynthesis of these sodium potassium ATPase pumps. So they inhibit the synthesis of more of these pumps, so you basically reduce the sodium reabsorption to the blood. There are other compounds that also we'll talk about that inhibit these channels, and they inhibit these sodium channels, so they prevent the sodium from being reabsorbed from the urine. All right, so there are two classes of compounds that can work on these. The first one is aldosterone receptor antagonists that will inhibit basically the production or the biosynthesis of more of these ATPase, sodium potassium ATPase pumps. And the second class of compounds inhibit these sodium channel basically, or they block these sodium channels and prevent the sodium reabsorption. The most important of these two types of drugs are the ones that work as aldosterone receptor antagonists, and those one basically inhibit the effect of the aldosterone of increasing the production of these basically sodium potassium ATPase. And this is what we see in the next slide, that there are the aldosterone is really necessary basically to bind to this mineral corticoids receptors اللي موجودين بالبلازما. And once this aldosterone, which is a hormone, binds to the mineral corticoid receptors, they will be forming a complex that goes inside to the nucleus. And once it's inside the nucleus, this mineral corticoid receptor is a member of this nuclear hormonal receptor, which causes an activation of biosynthesis of these sodium potassium ATPase by increasing their mRNA production, followed by the translation. So it activates, or basically it motivates production more of sodium potassium ATPase mRNAs, and basically increases the amount of sodium potassium ATPase in production, as we said. And so this is very important process because this aldosterone اللي هو hormonal mineral corticoid binds to their receptor in the plasma, forming a complex goes inside the nucleus, binds to basically to the genes there that are responsible for production of sodium potassium ATPase mRNA, enhance the production of this mRNA, and so increase the production of sodium potassium ATPase pumps. And so if we can block basically the binding of aldosterone to these receptors, we block this whole process. So if we block the binding over here, we block the production of more of this sodium potassium ATPase, and that results in less reabsorption of the sodium, and so basically enhance diuretic effect, or enhancing the sodium excretion in another word. Okay, so let's take a look at these aldosterone antagonists that we call them, that blocks the binding of aldosterone in this area. And these are aldosterone antagonists that are basically, as we said, block the effect of aldosterone, which is the hormone produced by the adrenal cortex, and that enhances the reabsorption of sodium in the distal convoluted tubule, as well as the collecting tubule cells. And so basically, this is a hormone that, as we said, enhances the production of sodium potassium ATPase pump. The most commonly known and the most important potassium sparing diuretics اللي هو يستخدم معروف كثير، اللي هو لكثير منكم as well، اللي هو spironolactone. And spironolactone is basically has similar structure to aldosterone, except that it has an extra ring over here, and there is a ester, as we see in the structure. So this is a hormone-like structure, a steroid-like structure in the spironolactone. You will see in that spironolactone. You don't have to memorize the structure, but I want you to know two things. One is that basically this is a steroid-like structure, صح? So a steroid-like compound. And the second one is basically, you will see that is the thioester is really important, because we're going to talk about that in a little bit. Okay, so this compound is the spironolactone, or what's known also commercially as aldactone, antagonizes the action of aldosterone. And so basically it inhibits the binding of aldosterone to its receptors, and so inhibit production of more of those sodium potassium ATPase. And so when we block the aldosterone, we block the sodium reabsorption, but not the potassium. And so you really excrete, or you basically cause an excretion of the sodium, and you preserve the potassium. And this is why we call it a potassium sparing diuretics. All right. What is it used for? It's used for various things. For edema, of course, because of its diuretic effect. It's used as antihypertensive agent. And it's typically not used as alone as an antihypertensive agent، لأنه effect تبعه very limited as a diuretic effect، زي ما حكينا، لأنه بيشتغل mainly على distal convoluted tubules as well as اللي هو collecting ducts, which has only about 1 to 2% of sodium capability reabsorption there. The primary use is used in combination with other diuretics to act on the collecting duct or the distal convoluted tubule to reduce the hypokalemic effect. حكينا هذا الاستخدام الأهم لهم، أنه they reduce the hypokalemic effect of the later groups of diuretics. Okay, of these groups of diuretics. Okay, هلا إذا استخدامه هو mainly for its potassium sparing diuretic effect. لكن له side effects مهم نعرفها، اللي هي of course لأنه saves potassium, so it could cause hyperkalemia, which is well known. It could cause metabolic acidosis, although it's not so common, but it can be, that's the case. And it could cause a very interesting adverse effect that we'll talk about in a little bit, that it could cause in men a gynecomastia. And this, the gynecomastia in men is caused by this medication, is important to know about. Why does that happen? Because the structure has a steroid-like structure, yes? So because it has a steroid-like structure, it does have a residual hormonal activity, specifically residual endocrinal hormonal activity. And so basically it's a side effect because of the structure, the steroid structure, steroid-like structure. And so that steroid-like structure would create it could bind to endocrine receptors as that and interfere with other hormones, Virgism. So it can create an imbalance between male and female hormones, specifically by displacing testosterone from the androgen receptors and the sex hormone globulins, which increases basically as a reaction to that increases estrogen production and metabolic clearance of testosterone بالمales. Specifically هذا إشي أهم إشي. So the net effect, it increases testosterone, estrogen production, reduces testosterone binding to its androgen receptor. So if you increase estrogen in the male, reduce testosterone, you'll see things like gynecomastia, which is basically an enlarge of the tissues in the breast in those males, and breast tenderness. And females, you'll see also the same effect, breast tenderness, as well as effect on the menstrual cycle because of its effect on the estrogen production or enhancing estrogen productions. So because of its residual hormonal activity, it does have these side effects of gynecomastia in the females and some menstrual disturbances in the females. However, I want to highlight something that's very important for spironolactone, and this is maybe well commonly known in some of the community pharmacies, but you should know about that. And that spironolactone is very commonly used for treatment of acne. Think about that for a minute here. I'm gonna pause and let you think first about how could spironolactone used for treatment of acne. Take a minute, think about it, think how could that be possibly happening with the use, how do spironolactones, or what is the mechanism they work through to basically treat acne. And it's really commonly used. A lot of times I've seen people prescribed spironolactone many times. كثير بنشوف وصفات احيانا بيكون فيهم spironolactone that's used for treatment of acne. The reason why spironolactone, if you think about it, is used for treatment of acne because it blocks the effect of androgen hormones like testosterone, which reduces the amount of oil والسيبم اللي موجود بالskin that's produced by skin, and that results in preventing the clogging of the pores and acne اللي بنشوفه بالpatients. So it's not like antibiotic treatment that you see in the acne. It's a different mechanism. It's complementary mechanism to these antibiotics that are used sometimes, but it's different, and it works by blocking the basically effective testosterone in these people that has acne, and so it reduces the production of these oils in the face and the skin specifically, and so reduces the clogging of pores and formation of acne. And so it's very effective hormonal treatment for acne in adult women with moderate to severe cases, and have seen it being prescribed so many times for patients for treatment of acne. Okay, so this is very important to know about spironolactone, and you probably will see at some point that there are prescriptions for spironolactone, not for its diuretic activities, especially إذا بيجيك شخص بيقول لك أنا healthy وما حد أعطاني spironolactone as a physician, it's probably likely for the treatment of acne in that patient. Okay, so as I mentioned, spironolactone مهم، واحد من أهم الالدوستيرون الانtagonist أو potassium sparing diuretics. The second compound that also used for its potassium sparing diuretic activity is also, or the second drug, is this drug that we'll talk about that's called eplerenone. And eplerenone, that basically is a structure you'll see here, has a similar also steroid-like structure. I'm gonna highlight that this is a steroid-like structure similar to previously structure that we see spironolactone. بس في طبعا اختلافات، وأهم اختلافات اللي بدنا نركز عليهم وجود الإيبوكسايد in the structure ووجود الميثيل ester here in that structure. Okay, so these are two things that are very important to highlight in the structure. Now I'm gonna say that the main importance of, or the difference between this structure and the other one, of course it's used as a potassium sparing diuretics, same way as the previous structure, and it's also an aldosterone antagonist زي اللي حكينا عنه structure قبل شوي تبع spironolactone. But what is really important about this structure is that it has less endocrine activity than spironolactone. Okay, it has less basically endocrine activity than spironolactone. Why is that the case if you look at the structure? The main reason for that less activity as less endocrine activity وجوا هاي الاستر فعليا. اوكي طيب هلا بدي احط هاي الرينج هي فقط الاختلاف اللي موجود بين هذا الستركشر والسبايرونولاكتون. بالسبايرونولاكتون الرينج الثانية اللي هي الرينج المشابهة هون فيها سلفر وثيوستر زي ما حكينا سابقا صح؟ طيب وهون راح نشوف ستراكشر، طبعا ما راح ارسم باقي الستراكشر بس انا بحكي الجزء اللي هو فيه السبايرونولاكتون. مش مهتم اني ارسم باقي الستراكشر للسبايرونولاكتون، لكن انا بحكي مينلي عن هذا الجزء اللي هو اللي فيه وراح اعمل له هايلايت اللي هو هذا اللي فيه الثايوستر. هلا هذا انسبايرونولاكتون تمام. It's called spironolactone. This is the structure we saw just a little bit ago. بينما لما بدي اطلع على structure هون لو بدي ارسمه بطريقة أخرى for the epilirinone you will see. لو بدي ارسم هذول الرينجز بس اللي هون هاي الجهة راح ارسمها للمقارنة فقط. بدي ارسمه هاي بهاي الجهة أو بهاي الاريا. طلع الستركشر you will see it has a carboxylic acid like structure. It's an ester of course. It's in an ester form صح؟ طيب in the spironolactone السلفر هون or what we call the thioester. This is the thioester moiety in the structure. It can be hydrolyzed. However, the hydrolysis of that structure, what does it result in? صار hydrolysis بالبلد راح ينتج لي هذا الستركشر اللي هو الثيول. And that thiol is still active metabolite. It's an active metabolite. تمام؟ مهم نعرف انه هذا الثيول اللي بتنتج من الهيدروليسيس of this thioester. If you hydrolyze it by esterases enzyme راح تعطيني اللي هي الactive metabolite thiol. So the metabolite of spironolactone راح اكتب هون spironolactone. The metabolite through esterases specifically gives an active metabolite. تمام؟ واضح؟ And that gives the spironolactone a good activity in various tissues لأنه ما بتأثر بالاستريزز بضل active. So بروح على التيشوز بالسكن، بروح بروح على other tissues as well, and that could cause اللي هو الإفكت تبعه side effects in terms of its androgenic effect, basically blocking the effect of these androgenic receptors. تمام لأنه بيشتغل عليهم وبيأثر وبيعطي تأثير فعليا على endocrine activity لأنه بيرتبط على هذول الريسبتورز. On the other side اللي هو if you look at the other structure eprinone حكينا فيه ester كمان. طيب هذا الاستر it can be hydrolyzed by esterases. راح ارسم هون if it was hydrolyzed by esterases what happened is that you basically hydrolyze هاي الاستر صح؟ خلينا نستخدم لون ثاني فقط ليكون الامور اوضح انه يصير هيدروليسيس لهاي الاستر. طيب شو راح ينتج عنه هذا الاستريزز هيدروليسيس؟ راح ينتج عنه هذا الستركشر. راح ارسم هذا الستركشر very briefly and you can see in that structure what do you get? You should get a carboxylic acid in that structure. If you hydrolyze that ester, just to draw a clean structure, you'll get what? You'll get a carboxylic acid in the structure after the esterases work on this compound. Okay? That carboxylic acid derivative is inactive, or carboxylic acid metabolite is inactive. So the metabolites of epilirinone اللي هم الكربوكسيليك acids are basically inactive. And what is the main reason? The main reason that it's inactive? It's too polar as a structure to bind to this lipophilic androgenic receptors, تمام? And so it doesn't have activity against aldosterone receptors ولا حتى any other androgenic or endocrine receptors or other mineralocorticoid receptors. So what happens is that the structure binds to the aldosterone receptor, prevent the aldosterone from working. But once it's away from that aldosterone بيجي الاستريزز بسرعة بيشتغل عليه، فما بتلاقي فيه له side effects كتير. Mainly that could result from this compound in terms of its endocrine activity or endocrine side effects. Okay, so that's the main reason for that whole thing, that this compound is very let's say selective with less side effects اللي هو ابليرينون. طب سؤال، هل انا بقدر استخدم الابليرينون for treatment of acne? No, it's not used because it's missing this side effects that's related to the endocrinic activity of this compound. So that eplerenone is selective as only potassium-sparing diuretics. It cannot be used for other purposes, as we mentioned in the previous slide, اللي هم related to acne. So in conclusion, this structure is a good potassium-sparing diuretic reagent, and it has a very good selectivity for aldosterone receptors اللي هم الريسبتورز المهمين عندنا بهاي الحالة. It has very little affinity or activity على other receptors زي androgen, progesterone, glucocorticoid receptors اللي بيسببوا لنا side effects. And so this is important to know. This is the main use for this structure is basically it's because of it has less endocrine activity than the spironolactone esters. طبعا هذا الحكي موجود هون اللي حكيته in terms of just saying what is the activity. I'm just erasing those things that I drew over here just to make it clear for everybody. Okay. All right, so these are the potassium sparing diuretics, the two ones that we talked about اللي هم الالدوستيرون والابليرينون. خلينا نحكي عن other channel that's really important in this collecting duct. حكينا هاي الchannel هي الابيثيليال صوديوم channel. بتتذكروا could be also blocked to block the sodium reabsorption. And this is the next class of compound that we'll talk about over here is basically the pyrazinoyl guanidines. And these are structure of compounds that used to block or block, in another word, the epithelial sodium channel. وبالتالي بيمنعوا reabsorption of sodium in general, and they spare the potassium in a similar way to potassium sparing diuretics. They are not very commonly used, but amiloride, but you still use them and you see their uses. They are moderately bound to plasmaproteins. Their oral bioavailability is not so great because of their extremely polar structure. Only about 15 to 20% of them get absorbed. So this is a low oral bioavailability in general. It's used in combination with other medications for the same reason as we see. It saves potassium. وبالتالي بيقلل chances of hypokalemia that results from these other diuretics زي hydrochlorothiazide and so on. طيب, how does it work exactly? اللي هو الاميلورايد, and as this is the structure, it works again by blocking or plugging the sodium channel and preventing the sodium from being reabsorbed from the tubular side of these collecting duct cells. نطلع على structure very briefly. I'm not gonna ask you about the details, so many details in the structure, بس بيهمني انت تعرف نقطة مهمة جدا. بهاي structures راح نشوفهم هذا structure الاميلورايد as well as trimethylene, another structure that does the same thing اللي هو blocking the sodium channel. They should have a positive charge. Why do they should have a positive charge? Because they're blocking a channel for sodium, صح? So this sodium channel is you need to have a compound that looks like sodium. So this is why they have a positive charge. And so what they do, they come where the sodium looks like, and the drug with a positive charge on it comes and blocks this sodium channel اللي موجودة حكينا عنها ال ENAC أو sodium epithelial channel. Okay? Look at the structure of these compounds. Look at the amiloride. And the amiloride structure, you will see it has a positive charge, as we said, because of its guanidine moiety. And the guanidine is very, very polar structure, صح? So it's this compound has, because it's polar, guanidine is very basic, very polar. It gets a positive charge, so it's positively charged at physiological pH. This is the most important thing that I should know, should tell you about. There's other amines as well, amines in the structure. مش كثير مهم بس يعني هاي لو بدك تعرفها هاي البيرازين ring that's why we call them pyrazinoyl guanidines and so this is a pyrazine ring. لكن اهم شيء تعرفه بالستركشر عندي هون انك تعرف انه هذا الستركشر has to be positively charged to mimic sodium, okay, to mimic sodium, and so they work by inhibiting this epithelial sodium channel. Another structure or another compound that has the same activity blocking the sodium channels in these late distal convoluted tubules as well as the collecting duct is the structure اللي هو triamterene, and the triamterene is basically a highly polar structure with multiple nitrogens. One of these nitrogens can be positively charged easily at physiological pH. I don't want you to know the SAR. It's not important for me at this stage. I just want you to know there are multiple amine in there in the structure. So it's highly basic structure, highly lipophilic structure. It has some structural similarity to folic acid, but doesn't interfere so much with other things. And it does the same thing. It blocks the sodium channel, epithelial sodium channel. It can be used for edema, for hypertension, but it's also used with combination with other diuretics زي ما حكينا to reduce hypokalemia or prevent hypokalemia. تمام? Okay. All right. So this is the only thing I should know about. You guys should know about these diuretics اللي هم البوتاسيوم sparing diuretics. حكينا في نوعين للتلخيص. النوع الأول اللي هو زي السبايرونولاكتون هم الالدوستيرون ريسبتور انتاجونست. والنوع الثاني اللي هم بيشتغلوا على الصوديوم channel أكثر and they block the sodium channel. زي ما حكينا عنهم التو compounds اللي هم الاميلورايد as well as triamterene. راح احكي عن اخر جزء بهاي المحاضرات الدايوريتكس وهو كلاس مختلف نوعا ما عن كل كلاس الدايوريتكس بهاي المحاضرة اللي هو الاوزموتيك دايوريتكس. والاوزموتيك دايوريتكس are basically compounds that work through increasing the density of the filtrates in the glomerulus. So they don't work on any channels or they don't work on any enzymes. They're very passive compounds, inert compounds if you want to call them. They prevent what basically reabsorption of water only because of their osmotic effect, which allows the water to be excreted. And as a result, you'll see more sodium and chloride excreted because there's more water excreted. So they're very, very inert compounds. They don't have very little effect on any kind of enzymes or anything. They are extremely polar structures. Okay, they're very, very polar structures. So they can only be given by IV. Their only route of administration is IV because extremely polar structures, and they don't have good oral bioavailability. صحيح? And their main thing after they're given by IV, you'll see that they're filtered passively by the glomerular filtration, and that increases the osmotic pressure inside that area, which means pulling more water into the urine or the tubular area, and that basically causes diuretic effects. They undergo very limited reabsorption in the renal tubules. هذا شيء مش مهم. They're very inert زي ما حكينا يعني ما لهم اي اكتيفيتي فعليا على اي انزيمز ولا اي شيء لا فارماكولوجيكالي ولا ميتابوليكلي لا بيصير عليهم ميتابوليزم ولا بيروح بيشتغلوا على اي انزيم ولا اي ريسبتورز ولا اي channels or anything like that. They're extremely water soluble as we mentioned, and so they only can be given by IV, nothing else. They're not orally bioavailable in any mean or any way. Okay, so the two examples of these two compounds that we will see اللي هم mannitol and thiophyllene. واكثر واحد بينطبق عليه هاي الاوزموتيك دايوريتيك كلاس اللي هو المانيتول وهو اهم واحد فيهم. طيب زي ما حكينا المانيتول highly polar structure. Look at the structure. عندك كله hydroxyl groups which basically is indication of very polar structure. This is the prototype of all osmotic diuretics. أهم واحد فيهم. And it's water soluble. It's very lipid insoluble, of course, because of its hexahydroxy alcohol moieties, 6 hydroxyl اللي موجودين بالstructure. It doesn't get absorbed, so you always have to do an intravenous route. Okay, it doesn't get absorbed in the GIT, or it doesn't get reabsorbed in the renal tubules epithelium. Once it's excreted بالtubules, بالglomerulus filtration صار عليه filtration صار inside the urine, it will never go back. It doesn't get reabsorbed للجسم. So, so basically, it's very polar and only can be given by intravenous. Once it's given by intravenous route and once it reaches its tubular area, بصير في عنا of course increase in osmotic pressure. Okay, and that increase in osmotic pressure pulls more of the water. So its high luminal fluid concentration creates an osmotic effect that prevent reabsorption of up to 28% of filtered load of water. لاحظ احنا بنحكي عن الووتر ما بنحكيش عن الصوديوم، بس الصوديوم بلحقه as a default. اوكي. شو بيستخدم المانيتول؟ المانيتول employed prophylactically to avoid acute renal failure and to reduce cerebrospinal fluid volume and pressure in some of the patients that have CSF injury or there's other causes for like tumors and so on. بيستخدموا احيانا المانيتول عشان يقللوا كمية المي، لأنه هون احنا بنطلع أهم شيء إنه to try to get rid of some water. We don't care about sodium ولا potassium يطلع أو so on. Okay. Also there is some other things that because the solution of mannitol may expand in the extracellular fluid اللي بالجسم, should be very careful especially يعني blood area or so on. Basically you should be careful with severe renal diseases patients or cardiac decompensation patients. Okay. All right, the last one that I'll talk about in the last slide for this class is the thiophylline, and the thiophylline is basically a methylxanthine, as you all know, and these structures has a flat bicyclic xanthine ring, as we can see in the structure, with two N-methyl groups, similar to caffeine with thiobromine. تمام. This is structure very similar to caffeine and thiobromine. So why does it cause weak diuresis? This thiophylline is known to cause weak diuresis, so it's not really used for its diuretic effect, but it has a weak diuretics because it inhibits the phosphodiesterase enzymes, or that increases cyclic AMP. That results usually in increase of cardiac output and increased renal blood flow, and that is a very minimal increase. So there's a mild increase in urine flow. وهذا الحكي بتشوفه لما تشرب قهوة، برضه نفس الشيء، نفس الكلاس اوف كومباوند اللي هم الزانثين رينج فيهم الزانثين، هم بيشتغلوا in the same way. and الكافيين لما تشربه بتحس انه في diuretic effect له بسيط بس موجود حقيقة. and so basically they do increase diuretic effect by stimulation of the cardiac function and direct action on the nephrons. Thiophylline زي ما حكينا is because of its weak diuretic effect and very less predictable effect of diuretic ما بنقدر نستخدمه as a diuretic drug. And the other reason why we don't use it as a diuretic, it has a narrow therapeutic index that's mainly used, make the compound only used mainly for its bronchodilator effect. بس مهم نعرف لما نستخدمه as bronchodilator اللي هو الثيوفيلين, it does have a side effect which could have a diuretic effect. So in conclusion, because of its structure like caffeine, it does a weak diuretic effect and it's not strong enough to be used as real diuretic, but this could be a side effect for the use of that compound for treatment as bronchodilation, or for the use of it as bronchodilation. Okay, with this we finish the diuretic class. This class is a little bit shorter than the previous ones, but this is the end of diuretic compounds and basically the medicinal chemistry of diuretics. And so next class we'll talk about a new topic. ويعطيكم العافية.